Hello, my name is Elizabeth and my topic is global health. Global health is an area for study, research, and practice that places a priority on improving health and achieving health equity for all people worldwide. It's important because in order to protect our own country, we need to be aware of what's happening elsewhere. Being able to identify diseases in other countries can help us be better equipped to prevent those diseases from coming here and spreading. It can also allow us to be better prepared with having to deal with those diseases if they do get here. Health threats are not localized. These can move to another area in as little as 36 hours. Part of this has to do with the fact that there are over 100,000 international flights every day. Some examples of diseases quickly spreading that you all might remember are the SARS outbreak in China, the spread of swine flu, the Ebola virus outbreak, and the Zika virus, which we're still dealing with. The main focuses of global health include HIV/AIDS, tuberculosis, malaria, neglected tropical diseases, family planning and reproductive health, maternal and child health. There are many programs and initiatives that have been established for these focus areas. Here I have some statistics of a few global health issues. Overall, worldwide, there are 56 million deaths each year. Many of these deaths are due to infectious diseases. About a third of all deaths in middle and low-income countries are from lower respiratory infections, tuberculosis, HIV/AIDS, malaria, and diarrheal diseases. There are 8.6 million cases of tuberculosis worldwide, and 1.3 million deaths occur from it. The number of cases of tuberculosis in the United States and Oklahoma has drastically declined over the past several years. And of the tuberculosis cases, many of them involve people who were not born in the United States, so they likely had it prior to coming here. As you can see on the slide, malaria is still a huge global health problem, with 219 million cases. Malaria has been eradicated in the United States since the early 1950s. There are still some new cases in the United States and Oklahoma. However, these cases are people who have been infected from traveling internationally. There are many programs that are aimed at preventing and improving these global health problems. The World Health Organization was created in 1948 and it is an agency for the United Nations that deals with international public health. They have offices in over 150 countries with many governments and partners to ensure all the people with the highest attainable level of health. The International Health Regulations was established in 2005, and it is a legal instrument involving 196 countries, including all the countries that are part of the World Health Organization. It works to provide health responses to the international spread of diseases. It's good because it requires countries to report to the World Health Organization if there are certain disease outbreaks or other problems that involve public health. The Global Fund began in 2002, and it is a partnership between governments, societies, the private sector, and people affected by HIV/AIDS, tuberculosis, or malaria in low and middle income countries. The United States is the largest donor, pledging $4.3 billion for 2017 through 2019. The money goes to supporting programs run by local experts in countries and communities in need. The Global Health Security Agenda was established in 2014 and is also a partnership between many agencies, nations, and organizations that are there to prevent infectious diseases from beginning and spreading to other areas. The United States committed $1 billion to support the implementation of the capacities of the International Health Regulations, which I mentioned on the previous. While this seems like a lot of money, they realize that it is cheaper to prevent disease outbreaks than it is to control them after the outbreak has started. The United States is the largest funder and implementer of global health programs in the world. There are many things that are done to participate in global health, providing financial support, delivering health services, participating in international health organizations, doing research, and supporting disaster relief and emergencies are some of the main roles. There are many federal agencies that are constantly working towards preventing and fixing global health issues, as well as participating in research. Under the United States Department of Health and Human Services, there is the CDC, the National Institute of Health, and the FDA. The CDC has 10 global disease detection centers that constantly work to improve overall public health. The NIH is the largest biomedical and public health research agency in the world, which is helpful for identifying and preventing diseases. I'm sure many of you know about the FDA, but they make sure food and medical products are safe within the United States and that any of those products that are going to come here are safe. The United States Agency for International Development administers civilian foreign aid, and I'm going to talk about it more on slides. The United States Global Health Initiative was started in 2009, and the United States invests $63 billion over 6 years. It is a comprehensive approach to U.S. global health policy that works to reinforce and make existing U.S. global health programs more efficient. It also helps partner countries improve their health outcomes. The goals of the programs are to prevent child and maternal deaths, control the HIV/AIDS epidemic, and fight infectious diseases. These are the programs that are under the United States Global Health Initiative. Feed the Future is an initiative to fight global hunger. The President's Malaria Initiative works to prevent malaria. USAID, the agency that I previously mentioned that administers foreign aid, has global health programs for fighting neglected tropical diseases and improving maternal and child health. They also support the implementation of PEPFAR and tuberculosis programs. PEPFAR is a collaboration with the Global Fund, and it works to control the AIDS pandemic and treats people in over 60 countries. To prevent the entry of health issues into the United States, the Immigration and Nationality Act was created in 1968. It requires all immigrants and refugees to undergo a medical screening exam before or upon entry into the United States, and it requires them to get another assessment after arriving to check for additional diseases and provide the individuals with permanent primary care and other health care services. Due to the broad nature of global health, there is not a lot of information about what Oklahoma has done towards it. However, OU College of Medicine's 3-year internal medicine residency program has a program called the Internal Medicine Global Health and Social Justice Program. It has a 2-year curriculum focused on current events in global health, and upon completion of it, the residents can participate in a 1-month international rotation during their 2nd and 3rd years of residency. Right now, the residents go to a rotation site in Uganda. It's beneficial because it educates the residents about global challenges in healthcare and allows them to provide care to patients with limited resources. It gives them good experiences with caring for patients in a setting that they are not used to. The Oklahoma State Department of Health website has information about global health threats and what people do before traveling to make sure that they stay safe and healthy. It also has information about vaccinations that are recommended before traveling to certain countries. Overall, it is important for everyone to be informed about global health as it can affect anyone. By being well informed about health threats, the United States can begin developing vaccines and have an action plan ready to be better prepared at dealing with anything that comes our way. There are many more organizations in the United States than what I have mentioned in my presentation, but I addressed the largest ones and those I thought were the most important. Through advances in medical research of disease threats, the United States is getting closer to the eradication of diseases like polio and meningitis, and we are excelling at the prevention and control of many communicable diseases. Here are all the websites I used to get the information in my presentation, and you can go to them if you would like more information. Thank you.